I want to introduce you to Hannah-Laura Gomes. She is the filmmaker who cares passionately about human rights and making social issues relatable. Creator of 4 web series, including Dirty 30, a docuseries about HIV/AIDS, and Lovestruck, where she interviews both survivors and perpetrators of domestic violence. Guest starred on FX's Louie, CBS's Blue Bloods, and had a reoccurring role on ABC's One Life to Live. I did not make it that far when I was reviewing this. Give us your best soap opera face just for a moment. Yeah. Thank you so much for joining us.
Thank you so much, Sonia, for that beautiful introduction. And thank you all, and thank you, MCON, for having us here so we can talk about an issue that matters so much to us. I started off with this issue. I went to go volunteer at Nkosi's Haven, which is an orphanage for women and children affected by this pandemic. I went with an organization, Arts Inside Out, which is an amazing arts program for the children and for the mothers. And I was going to go over there with my cameras, and I decided to do some research on HIV before I went, because I didn't want to subject these children to an uneducated camera or lens. And when I started to do research, the statistics that I found were mind-blowing. It wasn't what I had thought going in, and the pandemic had really changed in 30 years. And as I started to look for video content to familiarize myself more with these statistics, I didn't see video content that reflected these numbers or these demographics. So I decided at that moment that I was going to make a documentary series that did. So I traveled through South Africa, through the United States. I went to France to really get the face of the pandemic today. And I decided this was information that needed to be given away. I put it on YouTube for free. So as long as you have access to the internet and YouTube, you don't have to pay a cent. You can get that education. So.
Excellent.
Yeah, so I'm going to show you guys a little clip.
Please.
About, so you can get a taste for what the documentary is like, and we can talk a little bit about it afterwards.
Gender to me signifies that people that have been fighting HIV and AIDS for decades are fed up, frankly, that it's still an issue, and that it's lost the media attention that it deserves as an ongoing epidemic. And so GenDNet, I think, is a very needed next step to rally the next generation whose responsibility it is to really end AIDS.
I'm gonna start this series by doing the one thing Ma told me never to do, tell my real age. My name is Hannah-Laura, and I turned 30 this year. And so does HIV. I'm traveling the world to find the voices of the pandemic today, not rehash the images of the 80s and the 90s.
I never had a problem turning the tricks. If I was horny, I was gonna wanna have sex anyway.
If you're gonna cheat, if you're gonna pay for it, put a condom on.
It's a lot of the black men that are on the down low.
How does it affect your sex life? Like, do you...
Oh, God. I'm so glad you're asking this question.
The populations that were hit the hardest were the ones that had the least opportunity to voice what they were going through.
We're going to miss the mark with black women.
The common denominator is poverty and dark skin.
This is an answer I didn't see coming from nowhere.
That's great. We're going to get right to those questions in a second. I want to poll the audience. How many of you know who Elizabeth Taylor is? Okay, good. Thank goodness. I'm glad, because we've got some exciting things to talk about Elizabeth Taylor. But I want to introduce first Quinn Tivy, the grandson of Elizabeth Taylor and the trustee to the Elizabeth Taylor AIDS Foundation. He represents the foundation at high-profile events, including the International AIDS Conference, the Global Fund's 36th board meeting, the United Nations high-level meeting on ending AIDS, and more. Quinn, do you want to introduce this video?
Yeah, well, I've actually got a few slides. Basically, after my grandmother died, I embarked on a cross-country journey to explore some of the sites that her foundation had been funding and meet with some of the people that were directly affected by her work. So this first photo is of Matt, who I met in New York City at the Lower East Side Harm Reduction Center. and he was an injection drug user participating in a syringe exchange program that meant he was able to stay clean and avoid the risk of HIV transmission through dirty needles. However, he did find himself HIV positive upon engaging in unprotected sex with a girlfriend. So I start with this slide because he was in what is considered a high-risk category, yet found himself HIV positive in a very low-risk category of people. So I say this to point out that HIV does not discriminate. No matter what type of risk you might consider yourself a part of, you are always at risk. And so with that, I'll move on to Michael, who I met on the other side of the country in Portland. Michael was getting tested regularly for HIV until he found himself in a committed relationship, and he asked his partner if his partner had been tested, and his partner said, "Of course, I'm clean, don't worry about it." And so they decided to stop using protection, and a few months later he found himself HIV positive. And so, of course, this also serves to emphasize the importance of getting tested, open communication, honest communication, and a sense of communication that can allow for these types of difficult conversations. And we can get more into that a little bit later. And then this is Mary from the South. I met her in Atlanta at an organization called the Jerusalem House. She was a substitute teacher until she began using drugs and became so addicted that she ended up leaving her family, and she found herself homeless for a number of years, during which time she found that she was HIV positive. With the help of the Jerusalem House, she has gotten back on her feet. She's been reunited with her family. But I point out this photo in her story because it serves to emphasize the importance of secure housing, secure health care for everybody, even people that might not have a home, and support systems for people battling with addiction. And then on the other side of the world, we've been focusing on our international efforts in Malawi. And so this photo was taken at the inside of a community center, outside of which was posted one of our mobile healthcare clinics. And our mobile healthcare clinics integrate HIV services along with a number of other healthcare services. And when I was walking around one of these community centers, in the back, there was a blackboard, and it had some sex ed information on it. And I was with a cousin of mine who at the time was in high school. And he took a look at it, and he said that the sex ed on that blackboard in rural, remote Malawi was more comprehensive than the sex ed on his blackboard in Portland, Oregon. So we have a long way to go, but we know how to get there. This portrait of these men is also in Malawi, and it's at a place of employment, a tea estate. And it's an example, serves as an example of some male-specific testing efforts that we've began doing in Malawi, because in 2012, we realized we were only able to reach 1 man for every 5 women that we were testing. But since creating a number of interventions that we can chat a little bit more about, we've been able to level that almost from 1 to 5 to 1 to 1.6. And that speaks to being able to break down a lot of sexism and a lot of stigma. And then my last photo that I want to share is with a partner of ours, again in Malawi, which is grassroots soccer. And grassroots soccer focuses on incorporating HIV education and awareness services with programs that are attractive to youth. For example, soccer, like in the title, or shown here, dance routines. So internationally, we've been able to really engage everybody from a particular community we've been working in. And then nationally, we've been able to do that too, from coast to coast. So we're going to jump to some stats about what's going on here in the United States. But before we begin talking about what's on here, I just want to point out that of the roughly 37 million HIV cases in the world today, more than half, about 58%, are in 10 countries, and the United States is one of those 10 countries. So again, we have a long way to go, but we know how to get there. It's going to be a lot of work, though.
And I think as we look at these stats, we'll go through them right now, is that these numbers are reflective in certain populations, and they're affecting key demographics. And this is where HIV becomes a social justice issue. So let's start to look at these numbers and see what's happening. About 40,000 people are diagnosed with HIV each year. And again, these stats are in the United States. 39% of all new HIV cases are among young people ages 13 to 29. I remember when I found this out in my documentary, I gasped. I would not have thought that.
So actually, can anybody here who is 13 to 29, can you raise your hands, please?
Wow.
I mean, I'm sorry, I just missed the boat. I don't even feel like lucky to be invited, but.
Did you think of yourself as a group that is highly affected with HIV? This is your social justice issue. At least one teenager or young adult in this country is infected with HIV every hour of every day.
So it's like 3 o'clock or something now? What time did everybody wake up? I mean, you can do the math for just today alone.
All right. The CDC predicts that 1 in 2 black men who have sex with men will be diagnosed with HIV in their lifetime. 1 in 2. And here we're looking at the demographic of black men, which we all know is a very serious social justice issue in this country. 8 in 10 new youth HIV cases occur in young people of color. It catches me every time, I'm sorry. African Americans make up 44% of all new HIV diagnoses, although they comprise only 12% of the population. Now see, these 3 stats that I just went over here about people of color, and we all know that there are a lot of issues that are tied to this, whether it's access to education, access to health care, and the list goes on, right? Men who have sex with men make up 2% of the population, but 67% of all new HIV infections. Only 1 in 3 men who have sex with men have ever been tested for HIV. Testing is one of the hugest hurdles that we have to get over to see an end to AIDS. And 1 in 23 women and 1 in 36 men who inject drugs will be diagnosed with HIV in their lifetime. And when we talk about injection drug usage, one of the things I want to bring up is about injection drug usage in our prison system. We often think about HIV being spread in the prison system through unprotected sex, because of course condoms aren't provided to prisoners. But there is an injection drug problem in our prison system here in the United States that we rarely talk about. And to make progress on HIV, we really have to tackle who's being incarcerated and what they're doing while they're incarcerated.
And there's also actually 2 communities that aren't represented on this slide, but that are really important to note because they're also disproportionately affected by HIV, and that's the transgender community and the sex worker community. But due to stigmatization, discrimination, misgendering, criminalization, data is very difficult in some cases to procure for those communities, but it's important to note them here. I mean, this is basically the same map in 3 times. We're talking about mandated abstinence-based sex ed, which actually, you'll excuse me for looking at my phone, but this is a mouthful and it's important to note, and it's very sad today. We just heard today that the Trump administration appointed the leader of the Abstinence Only Until Marriage movement, Valerie Huber, as Chief of Staff to the Assistant Secretary for Health for the United States Department of Health and Human Services. And you can see what a potential risk that is for our country.
Can I jump in 1 second? There was a young woman who was in my trailer, Kia, who was born with HIV. And one of the issues that she had growing up was that nobody had an HIV sex talk with her. So she had to stumble through learning about how to have a healthy sex life with HIV on her own, because her mother had actually passed away when she was 13. So she really didn't have a person to go to for that. Now, she is representative of a lot of people with or without HIV. A lot of people in this country are not getting comprehensive and up-to-date sexual education about how to function, whether or not they're positive. So being positive and not having that information is an added barrier as well.
But you can see here we don't need to spend too much on it because it seems to be, I think, pretty clear. Using social issues like education or like poverty as references to people living with HIV, we see that there's an obvious correlation.
Definitely.
Should we talk about Elizabeth Taylor for just a moment before we get into the thick of the questions, because they're really intense. So let's get into the intense lavender eyes, the violet eyes of Elizabeth Taylor. I mean, she's an icon to the rest of us, but she's just, you know, family to you, right?
I didn't know Elizabeth Taylor, the celebrity. I knew Grandma. And I said, you know, I said something to that effect a couple weeks ago at another panel, and I talked about how raunchy she could be. And yeah, but then it wound up in page 6 the next day.
Okay, so we won't
it was
talk
like,
about that.
I have to be a little careful, I guess. But we would just hang out, and she'd give me girl advice, and like we'd eat peanut butter and jelly sandwiches, and that's who I knew. So it wasn't really until after she died that I began to dive more into a richer understanding of her public life.
And take on the cause that was so important to her. We have a little bit of information about her, correct? A short little video?
There's a video that we made about her path from actress to activist.
Okay, let's take a look at that quickly, and then we'll dive into the questions.
Loud, and I wear the pants in the house because somebody's got to.
From child star to ingenue,
lock the door,
to leading lady, Elizabeth Taylor was the brightest star in the world.
Hey, somebody's coming, man.
Her entire life on camera, she faced constant scrutiny. From almost losing her own life to the inconceivable loss of those closest to her, she persevered, channeling her strength into the greatest challenge she would ever face.
A rare form of cancer has triggered an epidemic. Deadly sexually transmitted.
I am here for those the world does not want to see.
I will remain here, as rowdy as I have to be.
President Bush, your policy is wrong, dead wrong, and you know it.
Elizabeth Taylor shook the world into action, carrying the torch.
Because the world needs you to live.
Of a true warrior.
What a great legacy to carry on. Who voiced that? Who did the narration?
Miley Cyrus.
Oh.
Pretty cool.
Yeah, that's kind of cool. Okay.
We're very grateful to her.
Okay, so into the questions. So the education of the AIDS crisis has changed a lot over the last 30 years, I'm sure. Have you seen a dramatic change in this decade, or has it been a slow progress?
Would you like to take that?
Or is the education just consistently bad?
I would say that the education is consistently bad. When I went around and traveled with my documentary, which was recent, many people did not have the information. Some people even infected with this virus who should be given that information so that they could walk responsibly, right?
Mm-hmm.
Because they want to, aren't given the proper information. So that access to that education is there, it's on the internet, but unless you're actively looking for the proper resources, you might not know where to find it, even though it's there. So it's accessible, but it's not necessarily delivered.
Yeah, I mean, what comes to mind for me right away is a friend of mine and a friend of the Elizabeth Taylor AIDS Foundation who found herself with an HIV-positive diagnosis and left saying, oh, cool, I'll be cured in a minute. Like she didn't, it took her a moment to grasp really what was happening because she didn't have that education, actually. And I already mentioned how shocking it was that my cousin saw better, more comprehensive sex ed in Malawi than in his high school in Portland.
Who's doing it right?
Well, there are great foundations out there right now. ETA is just one of the many, many ones doing it, but they're doing it really well. UNAIDS, there are people out there who are getting the information out. Just an example of this is, I didn't know that you needed to get tested as regularly as you do.
How regularly is it? I always thought it was 3 months, every 3 months.
Right.
Is that correct?
That is correct.
Okay.
Good job.
I
didn't know
I pay
that.
attention. I pay attention. So, I mean, one of the things when people say like, oh, well, I can just live with this now because there's this idea that you can now live with AIDS or HIV. How do you feel about using the term clean? This person is referencing people who are lucky enough to be free of STIs. Is it not shaming?
Yeah, and I think I might have even used that phrasing in my quote for Michael's story. I can't remember, but I believe that was a quote that he delivered from his partner. Absolutely, that can be a tricky water to navigate.
That's part of how I came up with the title of my documentary, which is Dirty 30, is a play on this idea of stigma attached to dirty and clean. But it's being used, so we need to talk about it and address it.
Why are women more likely to be diagnosed with HIV via injection drugs?
That's an interesting question, and I can't say exactly if that is even true. But I think that's what comes up first when I hear that question is it? But injection drug usage is an issue because in this country we don't deal with addiction the way that we should, right? And so there are we have more attention being focused on how to deal with healthy sex than we do on how to use drugs in a healthy way, right? If that's even a possible way to talk about it, or how to deal with your addiction so you don't have to worry about, am I using a clean needle?
Or to provide support services instead of penalize and criminalize, but support and rehabilitate.
Right, so the whole system on addiction needs to be strengthened in this country.
This group is that target audience that is being affected by this very important issue. If you could have them leave here today and do one thing, what would it be?
Get tested.
Yeah, get tested.
Change your relationship to getting tested.
Yeah, with your partner, on your own. Obviously, using Michael's story as an example, with your partner together, should you decide to do that, and communicate, talk, destigmatize.
Make it not a taboo subject.
There's nothing to be taboo about. Just be open and be supportive and communicative.
You shouldn't be embarrassed to ask your doctor for an HIV test.
I mean,
or your partner.
And we might say also that you can also get engaged by taking a few moments to consider how something that you're passionate about, whether it's filmmaking, taking pictures, just talking to people, or Twitter, can combine with something that you're interested in or furious about. And we both found ourselves interested in learning more about HIV, and that's how we began our journeys. So maybe it's something like that for you. And then ask yourself what your means are, whether that is a camera or your Twitter handle or a checkbook or your own 2 feet and whatever you can do with them, and how those things might be able to intersect to support your own work and your own involvement.
Thank you so much, Quinn and Hannah Laurie, for joining us today, and let's all go out and get tested and be more aware and break the stigma. Thank you so much.
Thank you. Thank you.